Good morning or good afternoon to our FOWS nursing aid students. This is Dr. Eugene, and I'll be your lecturer for this session. I've been doing a volunteer with FOWS since 2010, and I'm happy to share my knowledge about CPR for adults for this session. Okay, so without further delay, allow me to share my slides. So the program, if you are in the morning group, that is from 9 until 12:30, you'll be in the morning session. So by this time, I think you have received your schedule. In this morning session, you will have the lecture. Okay, you will have a staff demonstration. You will be given time to do student practice with the demo or with our mannequin. And at the end, you will take a theory test that everybody needs to pass before they can proceed to the practical exam. Okay, and then at the end, we will give you a short evaluation and we will value your feedback. Okay, for the afternoon session, if you are those group who are in the afternoon session, that would be the PM session. Starts at 1 until 4:30. And basically the same, you have the same program as the morning session. Okay, so for the passing criteria, you have to get 80% passing mark. So it's all MCQ question, meaning multiple choice question. So you have to choose the single best answer among the option that will be given to you. Okay, you will be given 10 minutes and you have 3 attempts. Okay, so hopefully everybody gets it on the first attempt. But if you don't get it, our volunteers will talk to you before you do your succeeding attempts. Okay, so hopefully you pass this theory test, okay, on your first attempt. Okay, once you pass the theory test, you can proceed to the practical test, and you must pass the one-man CPR. Okay, so that is our cardiopulmonary resuscitation. You also have 3 attempts, and if in the event that you cannot pass the 3 attempts, you will be scheduled for another day. Okay, so the availability will be again subject to scheduling issue. Okay, so hopefully, before this session is over, that you pass both theory and the practical tests. Okay, because of our current situation, okay, we will not allow changing of schedule unless there is a valid reason. And having said that, even if you have a valid reason, your schedule will be again subject to scheduling issue. Okay, so again, please do attend the schedule that was given to you beforehand. Okay, so let's proceed. So heart disease is the leading cause of death. And I think you've heard about WHO, especially that we are in the time of the pandemic this year, 2021, right? Started last year, 2020. Okay, so WHO stands for World Health Organization. So based on their data on 2018, coronary heart disease death in the Philippines reached over 120,000. So that's quite high. That represents close to 20% of the total deaths back home. What about in Singapore? Okay, this is the second most common cause of death. And based on the available data, there are 1,800 persons that develop an acute heart attack, and 1,000 suffer from sudden cardiac arrest in out of hospital environment. Okay, so the sad part about it is that the survival rate for pre-hospital is very low. It's about 3.4%. Okay, so both Singapore and Philippine setting, okay, the heart disease, heart attack, acute myocardial infarction, okay, is very concerning and is among the top, if not the top, reason for cause of death, okay, both in Singapore and the Philippines. Okay, so what are the symptoms of heart attack, right? So we ask you to do some pre-reading before coming to this assessment and practical tests, right? So a quick look at the symptoms of a heart attack. Okay, there will be chest discomfort. Okay, so sometimes patient will do this movement like there's something sort of pressing on my chest. Okay, so it's not a good feeling. So chest discomfort, again, is not a good feeling. Sometimes, aside from discomfort, there is also pain, okay, that is felt, okay, within the chest. Okay, so there is a feeling of pressure, sometimes squeezing, sometimes feeling of fullness and tightness, okay, in the chest area. Okay, so as I mentioned and I've demonstrated, usually it's located in the center of the chest behind the breastbone. Okay, so for those of you who have taken anatomy, in your module, breastbone is the common name for our bone called your sternum, right? So sternum, anatomically, that's the name, but commonly we call it breastbone. So if you put your fingers in the middle of your chest and you feel that hard bone in the middle, okay, that is your sternum or your breastbone. Okay, so typically also of this heart attack, it may spread to either shoulder, the neck, lower jaw, or arm, and occasionally to the upper abdomen. And usually this lasts longer than 20 minutes. So the chest pain uh, lasts longer than 20 minutes. Okay, so at this point, if the heart attack is severe, okay, so this is where it's very important that the patient seek consultation or be brought to the emergency department. If you're talking about in the Philippines or in Singapore, we say A&E or accident and emergency. Okay, so this is a heart and its blood vessel. I won't go into details because this is something that we all review in your anatomy class, but just a quick summary. Okay, if you can divide the heart into 4 chambers, you have the right atrium, you have the left atrium, you have the right ventricle, and you have the left ventricle. Okay, so blood flow starting from the right side of the heart, and it receives deoxygenated blood coming from the superior vena cava for upper extremities, okay, and from lower extremities, it is received from the inferior vena cava. Okay, so we don't have the inferior vena cava here in the picture. Okay, so it goes from the right side of the heart and get pumped through the pulmonary artery, and it goes to the lungs for oxygenation. Okay, and then comes back to the left side of the heart via your pulmonary veins, goes through the left atrium, goes through the left ventricle, and then get pumps to the aorta, okay, and goes to the systemic circulation to the rest of the body, and then the cycle is repeated again. Okay, so this is sort of an interplay between your cardiovascular and of course your respiratory system. So for your knowledge, kindly revise your understanding of the cardiac physiology and of course the respiratory physiology. Okay, so what is atherosclerosis? So this is basically sort of the buildup of fatty streaks or plaque in the lumen or inside your blood vessel. Okay, so normal coronary artery, it's very clean. Okay, and this is usually when we are in our youth, in our 20s, and as we grow older into our late 30s, 40s, 50s, and sometimes it's earlier, okay, depending on our risk factor and depending on the lifestyle that we are doing in our life. Like we like fatty food, we like salty food, then this build up of streak and plaque can be faster than the average individual. Okay, so without going into much detail, this is an example of your ECG. This is your electrocardiogram. If you go to the clinic or in the hospital, this is where they attach some wiring into the chest, and this is being monitored in the machine, and it comes with this sort of typical reading. So it basically reads the electrical impulse of your heart, right? So for those who are familiar with ECG, this is sort of your PQRS complex, right? And typically there is a typical look of your ECG, and if it looks different from the normal ECG, then we can make some judgment, okay, whether this patient is sort of having a heart attack, whether this patient has an enlarged heart, or maybe if the heart is beating fast or beating slow. So some of those are the information that we get from ECG. Okay, so you can revise your understanding again on ECG. Okay, so in terms of cardiac arrest, these are some of the finding based on ECG. You can have ventricular fibrillation. So if you compared it to the previous slide, this one doesn't have any pattern. It just look like up and down, up and down, up and down, right? The other one is your ventricular fibrillation. This is much more flat, okay, compared to your coarse ventricular fibrillation. And the other one is ventricular tachycardia. Tachycardia means the heart is beating very fast. Okay, so ventricular tachycardia, up and down, right? So again, if you compared it to the previous slide, let me go back to that. You can see that there is a typical pattern. Okay, so this is sort of what we expect from your ECG. Okay, again, if I flip to the next slide, you can see this is abnormal. Okay, so don't get so stressed if you don't understand or don't cannot read ECG, because this is something that you have to study for longer period of time. But at least if you can understand and can differentiate a normal from an abnormal, then at this level, that should be enough. Okay, so asystole or asystole. Okay, so this is sort of going to the flat line, right? So when somebody is classified sort of asystole or asystole or flatline, then that is very critical and fatal. Okay, so shift gear a little bit to the fibrillation. So you have those AED. You also have those smart AED that I'm sure you've seen on your way to this session, like in the MRT. You will see those AED posted near the gantry or near the exit. In HDB, you can also see some of those AED in the park or close to the park. They also have AED in some of the condo facility. There will be an AED in the gym or close to the pool or close to the sports facility. So there are many places where you have AED. Okay, so I guess we're very thankful that here in Singapore we have those option that we have AED if suddenly a person or a stranger or our relatives or our employer collapse, and we can locate easily where the nearest AED is. Okay, so let me talk about life being very important in terms of time. Okay, so the chances of survival, okay, is 100% or close to 100%, okay, within the first minute when somebody have a heart attack. And this goes down dramatically as the time lapses, right? So at 5 minutes after the heart attack, it's now about 50%. And if you wait for 9 minutes, the chance of survival goes down to even 10%, right? So what does this graph says us? That there is a golden minute or a golden period to save somebody when they have a heart attack, right? So ideally, okay, we have to either do a CPR and also call the paramedic or activate 995 within 10 minutes, okay? Better, of course, within 5 minutes, right? So, of course, there are other factors that will limit our ability to call help or to give CPR. But again, we have to be aware that time is of an essence. Okay, so the chance of survival is sort of directly related to what is our time or how fast is our response time. Okay, so what is CPR? I've already mentioned that earlier. This is cardiopulmonary resuscitation. Okay, so of course, when we refer to cardio, we refer to the heart circulation. When we say pulmonary, this refers to the breathing of oxygen. Okay, so the gas exchange of carbon dioxide and oxygen. And when we say resuscitation, we mean it is the maintenance of enough oxygen within the blood, and also within the blood circulation. Okay, so what are the risk factor of heart diseases? So diabetes is one. High blood pressure is another thing. So hopefully by this time, okay, you know how to take blood pressure. Okay, so if this is your first time attending this session, so hopefully you come for a session that we can teach you how to do blood pressure taking. Okay, of course, smoking, obesity, and lack of exercise are additional risk factor for heart diseases. Okay, so how do we control that? We do active and regular exercise. If somebody is smoking, then we stop, or we tell them, or we help them to stop smoking. And very important that we do screening as well for diabetes or patient who are high risk for diabetes, and also for those with high blood pressure. Okay, so this is very important, the chain of survival. Okay, so please revise this. Please remember this. The first one is early recognition and access, followed by early CPR, early defibrillation, and the last one is early advanced care. Okay, so this chain of survival is very important for you to remember. Okay, so early recognition and access, early CPR, early defibrillation, and early advanced care. Okay, so in times of emergency in Singapore, okay, we have to activate our EMS or emergency management system, and we have to call ambulance. So this, during the practical, they will tell you to make sure that before you start your CPR, you activate someone or you call someone. Please call 995 because you don't want to be alone with the patient after you start CPR and nobody's coming to help you or assist you, and you're already tired, and you forgot to call an ambulance, right? So make sure that during the practical session that you remember to call 995. Okay, so of course, if you are in the US, it's a different number. For the US, I think it's 911. In Philippines, I think that's also 911, right? And sometimes some localities or some cities will have their own number. Okay, so wherever you are, eventually when you land in that country, make sure that you know the emergency number. Okay, so different countries would have their own different system. Okay, so what is the future of sort of treating our patient with heart attack? Of course, that there's CPR, but also, as you know, and I've been telling you that there should be an AED perhaps within 500 meters, if not less, right? So something that we can access within 10 minutes, as we discussed in the golden period of survival. 10 minutes is very important. So if it's less than 500 meters, less than 300 meters away from the incident, or somewhere where a patient or a person or individual collapse, then the chance of survival is very high. Okay, so there are different types of AED now. So the future of AED is in the smart AED. Okay, so for those who are who wants to be sort of aware of the different advocacy in terms of, decreasing the risk factor and increasing good lifestyle and exercise diet, then you can find this on social media. Heart friendly, you can follow this, and it tells you some of the tips and suggestion on how we can prevent heart diseases. So again, this is heart-friendly organization. Okay, so let's go to the correct technique. Okay, so locating the correct landmark is one of the first thing that you have to do. Okay, locate for the lower half of the sternum or your breastbone. Again, during the practice session and the demonstration, our staff will demonstrate for you. And after the demonstration, then you have to do your return demo. Okay, so it's very important that you do a proper compression. Okay, so elbows straight. Okay, so you have the pressure coming from your shoulder as you compress the chest of the victim or the patient. Okay, so we won't do any infant CPR, but for those who are interested, I think in the future we will come up with some succeeding session and training session for the infant CPR. If you're interested, do let our team knows at the end of this session that you're interested to sign up for the infant CPR. Okay, so but that would be different from this training, and that would be a different schedule and a different session, right? So do send or tell us your interest by telling one of the staff if you're interested in the future for to learn about infant CPR. Okay, so we don't have the details, all the details now, but you can signify your interest if you are interested to sign up for infant CPR in the near future. Okay, so the sequence you can see on your screen. Check for danger. Okay, so establish unresponsiveness. So normally you say, "Are you okay?" Normally we say, "Hello, hello, are you okay?" "Hello, hello, are you okay?" And then you tap the shoulder of the patient who's probably lying flat on the floor or on the street, right? Because he collapsed, right? Then don't forget to immediately call 995 and ask somebody to get AED. Okay, so for clarity, and in Singapore, very efficient, very few words. Okay, you can just say call 995 and get AED, right? Or you can say please call 995 and get me AED. Okay, so short and sweet. Okay, so you have to do this immediately. You have to do an open airway. And what is the technique? We say a head tilt chin lift. Okay, so please remember this. This is a must know. Head tilt chin lift. Okay, so the again, the staff will show you how to do it properly. Okay, so make sure that you are only pressing on the bone, okay, and not in the middle or blocking the breathing or the throat. Okay, so again, head till chin lift. After that, please do the recognition for cardiac arrest. Check for normal breathing. If the patient is gasping for air, or if the patient is normally breathing. Sometimes maybe it could be not an issue of cardiac arrest or heart attack. Maybe the patient is just maybe had too much alcohol to drink and is just sleeping. So make sure that you don't do CPR on somebody who is sleeping or just intoxicated, right? So the management for that is different. Okay, check the pulse. Normally, for trained healthcare providers, for adult, we do the carotid pulse. Again, you should be around the middle of the neck and slightly move to the left or to the right, and you can feel the carotid pulse, both on the right and to the left. Okay, but normally we check only one side. Don't press both carotid right and left at the same time. Only uh, one at a time. Okay, and then start your compression. If breathing and pulse are absent, or if you are unsure about its present, start chest compression and perform 5 cycles of CPR. So we do 30 cycles and 2 breaths. Okay, so again, these are the CPR sequence, and we're just focusing on adult CPR. Okay, so in the future, again, we can do a child CPR and infant CPR, but that would be sometime in the future. Okay, so landmark, okay, heel of one hand, other on the top. Compression, again, this is must know. For adults, you have to compress as deep as about 5 centimeter. 5 centimeter. And the compression rate is 100 to 120 minutes. So what does it say? So when you count 1 and 2 and 3 and 4 and 5, 1 and 2 and 3 and 4 and 10, and you have to do this until 30. So it's much faster than your typical 1, 2, 3, okay, because this is 100 to 120 minutes. So this is faster than your usual counting, like double, right? Because in 1 minute, we have 60 seconds. So you have to sort of count 100 to 120 times within 1 minute. Okay, so that is the compression rate. Compression and the ratio to ventilation ratio is 30 to 2. So 30 compression, 2 breaths. And breathing should be 2 breaths at 1 second per breath. Okay, so this is the standard that we do, and this is the summary of the difference. Okay, so pay particular attention for the staff or to the staff who will be demonstrating in front of you. Listen attentively, take down notes, and pay particular attention to the steps. Okay, that's very important. Pay very particular attention to the movement of the hands, the counting, the location, and the landmarks, right? Where the staff will place their hands during the CPR. Okay, so this is the summary for your adult CPR. Okay, so just to finish this off, okay, chances of survival is improved if a person collapses in the presence of CPR-trained individual. So at this point, I already congratulate you for making an effort, okay, to learn CPR. And I know this is part of your curriculum. And again, I congratulate you for the effort that you're doing. And hopefully we become part of the community where we can contribute to the saving of lives of people who, suddenly would collapse because of heart issue or heart attack issue. Okay, so here you can see sort of a bystander helping. He's not a healthcare professional, he's not trained. Okay, and he's using a smart AED. Okay, again with smart AED, you just have to follow the instruction, and it will tell you what to do step by step. So it's normally in English, but in some countries you can change it to another language where the local are more familiar, right? So that would be helpful, right? So again, if for example, if you are more of Tagalog based, then it would be in Tagalog. If you're Korean, then it would be more Korean, right? But again, in our FOWS nursing aid program, we mostly speak English, so we will use English as the standard basis of our teaching. Okay, so again, this is AED. Similar to infant CPR and child CPR, we will have a future training for AED and where we can issue or give you some training and hopefully certificate as well. So please do tell our staff if you are interested to attend the AED training. Okay, so this is usually a half-day training session. Okay, so please let us know. We don't have, again, the complete details, but kindly give your name to any of the volunteers if you are interested in either of the AED or smart AED training, and also the the infant and the child CPR. Okay, so this is something that we will do in the future. I hope you will come back to Bayanihan FOWS for those additional training. Okay, of course, these are optional, and these are something that can add value to your training. Okay, in addition to your training for the nursing aid program. Okay, so let me stop here first. I'll try to share a short video. This is for about 2 minutes. Listen, and hopefully this can add to your understanding of the CPR.
About the last part of the RSABC, which is CPR. CPR stands for cardiopulmonary resuscitation. So after checking that there is no breathing, please commence CPR immediately. Now, this requires accuracy. Do you know where to place your hands when performing CPR? Place your hand on the lower half of the casualty's breastbone, also known as the sternum. Place your other hand over the first hand, interlace your fingers and lift your fingers off the chest wall. Next, straighten both elbows and lock them. Lean forward and position your shoulders directly above your hands and the casualty's chest. From this position, you can see that your body weight is directly above your hands. And using your body weight, compress downwards with a depth of about 4 to 6 cm, or 1/3 of the chest at a rate of about 100 to 120 compressions per minute. You can use the song Staying Alive or Count on Me Singapore to help you remember how to count at the correct rate. The chest wall must be allowed to recoil fully. Next, you must count out loudly 1 and 2 and 3 and 4 and 5 and 1 and 2 and 3 and 4 and 10, all the way to 30. The two ventilations are the mouth-to-mouth breathing, but this is only if you are willing or trained. So this is how you do it. Pinch the casualty's nose with your index finger and thumb, and seal your lips around the casualty's mouth. Give 2 quick short breaths, each lasting for 1 second. Each breath should have enough air to make the chest rise. And this is approximately 400 to 600 milliliters of air. You can remember this sequence by pinch, blow, release, pinch, blow, release. Note, if you can't provide mouth-to-mouth breathing, you should deliver continuous chest compressions until help arrives. If you are tired, you can take a 10-second rest between every 100 chest compressions. Giving 30 compressions and 2 ventilations is considered 1 cycle. You should continue this until any of the following takes over: either the casualty regains consciousness, or ambulance arrives, or AED prompts you to stay clear. We'll cover more about the AED in the next video.
Again, thank you very much. This is where we end the lecture part and the video part on your CPR. Okay, so before I end, okay, please do revise your materials on CPR. I wish you all the best for your written and also practical tests. Okay, and remember, okay, the purpose of this is that we can save lives. Okay, so our knowledge on this and our training is hopefully will benefit in terms of emergency, that we have some knowledge how to do CPR training. Okay, so again, thank you very much, and enjoy your session, and I'll see you very soon. Thank you very much.